Thank you for tuning in to the ADHD Coach Podcast. I'm your host, Gloria Joy Sherrod, licensed clinical professional counselor and ADHD expert, and I'm here to share with you a wealth of information on how you can manage your ADHD in adulthood. Hey there, it's Gloria. I just wanted to give you all a heads up that we do talk about suicide briefly in this episode, which I know can be distressing for some. So if you need resources or support, you can call or text 988, which is the Suicide and Crisis Lifeline in the U.S., or go to www.findahotline.com to find the hotline in your country, as I know I have listeners all over. I'm here with Dr. Kalaki Clarke, MD. She is a board-certified family physician and volunteer adjunct clinical instructor of medical education for the Keck School of Medicine of USC. As a Los Angeles native, she passionately provides care for individuals experiencing homelessness downtown on Skid Row, Los Angeles Christian Health Centers. Receiving a late diagnosis of attention deficit hyperactivity disorder at age 35 propelled Dr. Clarke's enthusiasm as an advocate for mental health and ADHD. How does that sound?
Perfect.
Awesome. So I'm so glad to have you here. I really just wanted to talk today about your personal experience in navigating some tips for advocacy in your educational experience and at work, and then some of your perspectives as a provider, kind of diagnosing and treating people with ADHD.
Awesome. Thank you so much, Gloria, for having me. This is a privilege and an honor. So yes, I am Dr. Kalaki Clarke. I am basically what I tell patients, I'm the patient and the clinician at the same time. So the way I found out about my diagnosis, growing up as a child, I've always wanted to become a physician. School went well for me. I actually enjoyed school. I, was not a hyperactive child that got on everyone's nerves or drew attention to myself. Was able to get into medical school with a full scholarship. Creighton University in Omaha, Nebraska. I did well. And then it was right after I graduated from medical school and started residency training, in which I had a severe episode of depression, which caused me to kind of have a little pause in my training, my educational process, because I needed to take a break for self-care. I needed to find out who I wanted to be in this life, because at the time I was very depressed and suicidal and knew that as a doctor, this wasn't the route that I want to go. I will say fast forward to 2014, I actually reapplied to go back to residency after practicing for 7 years with a California medical license. I said, I'm going to be board certified. I was persistent. I didn't know why I was persistent, and we'll get to that later, because we can be persistent as ADHDers when we have our eye on the prize, right? So the goal was just I'm going to be board certified. I don't care. I actually felt confident because during the 7 years practicing on my own, I felt like I had taught myself a lot of medicine and I knew how to take care of patients, at least in a clinic setting. And family medicine mostly is outpatient. So then in my mind, I'm like, you know what, I can do this. And even though residency was challenging, the first time I attempted when I graduated from medical school in 2005, the difference was I knew where I was going with it. So at first it was just like, oh, this is too much. It's overwhelming in the hospital. It's not worth it. But my attitude when I applied 2 times before I got into family medicine residency was, you know what? I know the goal. The goal is I'm going to be board certified. At least I know what I'm doing because of my own, self-learning experience. So what ended up happening is once I started training in family medicine, I felt pretty confident because of my experience I had previously teaching myself. But then something started to shift when it came to my first year of training, about the second half of it. So that was when I started to have a lot of heavy in-hospital experiences, which kind of triggered some of the feelings I was having the first time around. And some of those symptoms where I was very disorganized. I was basically all over the place when it was time for me to give presentations to the attending physicians about the patients. I was always late when it comes to checking in to present the patients. I always stayed late afterwards. I was losing things all over the place. And I knew I was not depressed because prior, my depression or my symptoms were just like, I don't want to be here. This is just too much. I can't deal. I'm just tired. I'm not eating. I'm not sleeping. Whereas this was, I still want to be here, but I'm just frustrated because I'm making all these efforts and doing twice as hard as everyone else, but just not cutting it. So it was a different feeling, and I didn't know quite what it was until I had a rotation with a child and adolescent psychiatrist, and she was interviewing kids, and they were like smart but scattered. They were taking forever to do things. They were losing things, and they were basically describing me. So I was like, ding, 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 ding. Went on my own little research about what ADHD is, and it was like, okay, this is it. This is it. So 2/3 of my experience in training were health, period. And the reason why is because it took a lot of, let's put it this way, educating and self-advocating and learning about ADHD myself, and also impressing upon those supervising me that I was competent and capable and just needed to have the appropriate accommodations and support in order to move forward and thrive. It's unfortunate that ADHD education, even among psychiatry residencies, I think it's becoming a bit better now, but is not as abundant, I will say. So there's a lack of knowledge when it comes to medical professionals, even understanding what it entails and what it doesn't mean. So it was no doubt that I have intellect, because you really cannot get through medical school and beyond that with a low IQ, just to be honest with you. So it's just a matter of me being able to demonstrate that. What I end up doing is, like I said, a lot of self-advocacy. During the time period, I did all I could in regards to seeking a formal diagnosis from a psychologist. So someone outside of me just saying I have ADHD, because I could tell it just looked like a duck, talked like a duck. It was a duck. And so psychologist confirmed it. I did some neurofeedback therapy during that time. I got away from a psychiatrist, which was not serving me in regards to not getting better on medicine, and transitioned to someone who was very astute in treating it. And she is my psychiatrist to this very day. God bless. Shout out to Dr. Kat Dang, insightful minds in Newport Beach, California. Been my doctor for 7 years, and she knows my brain and how to get it right. Love her. So got that support, received, I started getting coaching. I'm sure you've heard of Dana Rayburn. She was my first ADHD coach I ever had. She really helped me get through, I would say, the year, like 6 months, basically, my training, which was so helpful. I just did everything I could to support my staying in the program, because, there's a fine line between being kicked out and being supported. Let's put it that way. Because if there's not an understanding of what's going on with you, then the default thought process is you're not competent, you can't do it. However, once people are educated and you are supported, it's not like magically you become this just whiz kid and you're perfect. No, you're actually put in a situation where you're able to demonstrate your true capacity. And so by the time I finished training, which is about 3 months after I would have if I hadn't had any pauses, which I did for like medical management and adjustments, I was doing very well. I had buddies who were previously ones who were in authority to try to dismiss me. They were like my friends and everything by the time it was all done. And so with that, yes, I mean, like, it's like I can literally call all of them right now, and we're just like, hey, like, and I never want to bash my program just because they helped me accomplish my goal. But the true thing was that I was determined, hell or high water, to get through my training. So that means if I have to educate you, if I have to research what the rules are, because I can be told something, and when I look it up and it's something different and I bring it back to you, then what can you say? It's like, if you don't know, anyone can tell you anything. So I kind of had to do research about certain things in order to hold my position. And I will say that since then, it just made me realize, what, this ADHD is so, my gosh, it's so unknown and so misunderstood. I cannot be the only one to just find my way through and not help other people.
Wow.
It's just like selfish to do that.
Yeah, that is amazing. I have so many questions, but going back to what you were saying about what they learn in psychiatry school about ADHD, what would you say is the level of training that doctors receive about ADHD and really neurodivergence in general?
Well, see, I went to medical school in the Stone Ages, which means like between I entered medical school in 2001 and graduated 2005. Okay, so we're talking about, you do the math, 20 years ago or something like that, almost,
Yeah.
whatever.
We
So
didn't
back,
know as much then at all.
oh my goodness,
Yeah.
here's what we learned in medical school. I kid you not, it's just like a really small portion in I don't know what class exactly about ADHD. First of all, when I was in school, autism was a blur. Like it wasn't even that much emphasized. I think ADHD got more attention than autism, although the ADHD education was still lacking in itself. So ADHD was the hyperactive little boy who can't stay still and needs to be on stimulants. That's all we knew about. There was never education about the inattentive component and, the quiet girl who's daydreaming and losing things and, can't concentrate very well. So that's why later on, when I came to that epiphany or realization, shoot, this will be like 9 years later that this was my diagnosis, it was shocking to me because there was no dots connected based on my own previous experience. And I will say, after I finished training residency, I did a 1-year fellowship in primary care psychiatry, and it was 12 months, and we would have these didactic. So I'm still working, but it's like we meet virtually once a month. That we have a mentor who like is someone we can ask questions, about psychiatry. It was 2019, so that's what, 4 years ago or less, or whatever the math is. So
Wow.
there's a lot of work left to be done. And so that's why I'm passionate about advocating for us as people with ADHD, understanding our rights, so to speak, or understanding that whatever's going on is not our fault and that we are still competent and capable. We just need the right support. Let me just share with you what's happened after residency. So since residency, in my awareness of my diagnosis, in the work field, when it comes to like employment, basically when it comes to asking questions like, do you have any mental, whatever, anything psychiatric or something, I would say yes, period, and say what it is, ADHD, a history of depression. And I'm just so out there because in my opinion, and I've said this previously, my situation with ADHD, even when managed as well as it can be, is still relatively obvious and noticeable, that if I don't mention it in the front, I don't want to risk the challenge or issue of me being later on, exiled, or what's wrong with this person. I told you at the day one, I told you, look, go back in your paperwork. That's what's going on, ma'am. So now that you understand that, what are we going to do about it? So because here's the thing, this is why I view it. If you see that and you don't want me, I'll know from the beginning, right? Then I'll move on. I won't go through and be tormented by you and humiliated and dragged when I can spare that by letting you know what's going on in the beginning.
Wow.
That's just how my thoughts are.
That is, no, that's such a good point, because I think that when we are reactive and we wait to tell people what's going on, wait till we're struggling, then it almost seems even more to them like, oh, that's just an excuse because now you're telling me that when you're struggling instead of telling me up front.
Yeah, it's too late.
Yeah. Yeah. So I think that's a good observation.
Yeah. And so what I've done is just been a parent or outright with my situation, on 2 incidences. I mentioned this previously. I've actually disclosed my diagnosis and was hired for the job like 2 days later, literally, because, what they see is, okay, she's straight up. So that means that she seems like someone we can trust and we can work with, that she must really want it to put it out there, because it's really hard to fake it. For me, it's hard to fake. You can't fake being on time if you're not on time. If you have time management, like how do you fake that being late? The posture you should have, and then, what to do forward. Okay. So this is just something I created just based on my own experience, because currently I do have, accommodations at my workplace. Been there for 3 years now. And like I said, I told her from the beginning. So her statement was, so it sounds like you get things done. It just takes a long time for you to do it. Bingo. And so with that understanding, we can make things work out, which for me, my accommodations look like, so I've made my own accommodation, first of all, where I only work 4 days a week instead of 5 days a week. Okay. Because I need the mental break in between. And so even though I am not physically at work in practice on a Thursday, I'm I'm still doing work like administrative paperwork, reviewing things, labs, or whatever, but I'm not physically in front of a patient every single day. So that's my own form of accommodation. We have a certain amount of time we have to lock our charts in clinic. So I have additional, like maybe instead of a note being locked in 5 days, mine can be locked in 7 days. And I'm privileged and blessed and thankful that I have a scribe, a virtual scribe actually, that helps me when I'm, for my documentation. So I'm able to not worry about the excess typing and whatnot that is really belaboring. Instead of me taking 25 minutes to do one note, her assistant has it help me have it done in 10 minutes or less. And that adds up after time.
It does. I am super intrigued as a therapist because, we also have notes and things. And I feel like a lot of ADHD therapists struggle primarily with the paperwork part because we see the job and we think, oh, like this is right up my alley. I get to talk to people all day. And then you realize actually you get to talk to people all day and then you have to write all of that down afterwards.
Yes.
And I think that specific blurb about what you have in order to accommodate you with that is amazing and will help a lot of people.
Yes. And it helps me be less burnt out so that I'm able to give more to patients and not feel like looking at them like another note. You know what I mean? That's kind of how it started to be like,
Yes.
oh my gosh, more work to do. Now here, let me tell you with that though, I'm being real. This doesn't mean I have all my notes up to date right now. Does not mean that. It does not mean that because I have an assistant. What it does, it reduces the number of open notes that I have. And the reason why they still might be open is because even if I get assistance with the majority of the note, there might be other little things that the scribe is not really allowed to or able to assist me with that I have yet to do. And so then I don't really close that note until everything is done with that, whatever it is that needs to be done. So a lot of it is not like super time sensitive, but it's something that still they can help me out with.
What did you tell your employer in order to help them understand what it is that you needed? Because I know a lot of people are afraid that, they'll tell their employer that they have ADHD and the employer will have that stigma about what ADHD is. How did you kind of get through that part?
I gave some articles. I gave her some things to read about ADHD, I believe, and just explained that this is another thing that I educate. So part of my education is giving scenarios or illustrations. So I say, imagine going into a room or bringing me information to a room and you have a file cabinet, right? And, for the person that does not have ADHD, all the contents go neatly into files. They're being put into files. Whereas for me, you bring the content and it's dumped on the floor. So it's there, the information is still there. It just takes me a while to make sense of it all and put those things in the file where they belong in order for them to be useful. You know what I mean? So I give those types of examples and just also clarify and say, I'm late here, but I'm late to church. I'm late to go to pick up my daughter. I'm late to this. I'm late everywhere. So that you don't think this is a personal thing towards you. This is, I'm wherever I am wherever I go. So I explained that situation. I also explained the things that I have in place that are to help me. So there's not like I'm saying these challenges and then saying, oh, well. So I say I have a ADHD coach who I work with who helps me out with structuring and planning. So the thing is, even if you think this is bad, trust, it'll be worse if I did not have these things in place. So just keep that in perspective. So I say I talk to a therapist once or twice a month. I am taking medication that helps me to keep my focus. And, I create systems for myself and try to work with them and maintain them. So I make it clear that I'm doing my part to help out with the situation. You are the expert in ADHD. And not that you have to over talk, but you don't present yourself in a posture of being like just defending yourself. You're more so being the expert in educating someone about it. So, for example, you can say, you acknowledge, first of all, you need to acknowledge what your challenges are, because if based on whatever your struggles are, that is what is going to determine what your accommodation is going to be. So if I have an issue with the time management, then definitely I have to do my part the night before and pre-planning and everything. But a compromise form of accommodation would be the supervisor can allow me a time window, between 9 and 9:15. And so maybe there's a certain amount of times where it's not the greatest if more than 3 times in a month are you there after 9:15. So you have a little wiggle room and that you're not just being so punished, so to speak, because of your own, inherent neurobiological challenge. So just have if you're educating. Also, just for everyone to know, the American Disabilities Act, which was started in 1980, the ADHD, it is considered a disability. However, it needs to actually have impairment as part of the struggles. So meaning if your ADHD is very well managed, meaning you're not having challenges that are obvious on the job and you're able to do your work, then it might not be a need to necessarily disclose because you're doing fine, right? So you're not, quote, disabled as a result. It's very well managed. However, if you are diagnosed with ADHD and you haven't disclosed, but then you're kind of getting in trouble a little bit based on things that are ADHD related and you know it, you either decide to disclose and share what's going on, or you figure out a way to get systems in place for yourself to not be in trouble anymore. Third
Absolutely.
situation is if you have told them somehow and you're still getting in trouble. That, in my opinion, is when the latest you should be waiting to request accommodations. Because if they know and you're getting in trouble as a result of it because you haven't really figured out what to do, you need to talk about having accommodations. And one of the first things to do is to make sure you've communicated with HR that they have a copy of the physician or whoever diagnosed you or whoever is taking care of you, that you do have the diagnosis. In fact, that needs to be on file, because if that's not in file, you really don't have much protection for yourself in that regard, because anybody can say they have ADHD and that not be reality. So then it's a legal thing where you requesting accommodations, it's not unheard of because you have that protection by the ADA to support you. A very useful resource that I think everyone should be aware of is the askjan.org. AskJan is the Job Accommodation Network, which is a beautiful resource that for every disability that there is, it essentially gives you recommendations or ideas for accommodations based on either what your challenge is with the diagnosis or what your job function is. So for example, if you go to the Jan Accommodation Network, jan.org, and you type up ADHD, they will break it down for you to see, like, for example, if you go to attentiveness and concentration, they will break down either disruptive behavior, executive function deficits, managing time, memory loss, multitasking, social skills. And then for each of those, topics, you could press it and see what the recommendations or possible, tools you can use in order to help out with that. So that's also a good resource to give to your supervisor, to actually give them ideas of how they can support you, so that it's not like they're just clueless. You've come to the plate with saying what you think may help you. You've given them a resource that can help them help you. You know what I mean? And you're taking accountability for yourself and keeping your job.
Amazing. Those are amazing tips. Very helpful. Did you have any other tips for school-related accommodations and work-related accommodations?
Well, in regards to related, here's the deal. It's challenging for me to offhand just rattle it out, just because in school, even medical school, I was unaware of my diagnoses. So then it's kind of like, it's not a reflexive, this is what you do from my head, you know what I mean? Because it wasn't based on experience. However, at this point, I do know there are a lot of also different resources out that, give you, I think teenagers definitely career, people starting their career out do need to, find an ADHD coach. So I'm sure definitely connecting with your resource center prior to starting college or whatnot will be helpful to kind of have in line. Definitely important to have all your records from, previous, if you had an IEP or anything else to support your learning, evidence that confirms your diagnosis. Just keep good records of everything, so that when it's time for you to request those accommodations, and you won't seem like you're just pulling it out of nowhere, and that you show a record that been supported previously by, let's say, accommodations. So then now is not just something coming out of nowhere. And I will say, training, when I was in residency, I received accommodations for my family medicine boards, which all that meant was I had double time to take my test it was, instead of it being one day of testing, because the whole thing is like 8 hours, it was 2 days. So 4 hours one day and 4 hours another day. And then I had extra break time. And I was in a room by myself, to like cancel out all the distractions, get a break for fatigue. And it was the same exact test. And when I was in training, they make us do practice tests. So the first 2 years, I didn't have accommodations. Last year when I had accommodations, I did very well. And then when I took the actual exam with accommodations, I blew it out the water. So it really shows that, having that support is basically essential because, people with ADHD, if you work with them, they will work with you. Like they would like go above and beyond to do their job because, feeling supported is what actually fosters and helps support you to want to do your job more, to like be motivated because you feel like, okay, these people are helping me, they're working with me. Let me show them I can really do it and let them know that their efforts to help me are not in vain and I'm gonna do a good job.
Absolutely. And with school, so I was actually just talking to someone about this in the last episode that I recorded that is not out yet. But we were talking all about disabilities and chronic conditions and ADHD, and the fact that for us, so I was in a doctoral program, this other person was in a PhD program at one point, and just talking about the great level of stress and anxiety and depression that is very common in those programs.
Mhm.
What are your thoughts about that? I know that's such a broad question.
The stress programs like without having ADHD or
In general, but
this it's
especially
there
with us.
in regards to is more so really like physician suicide and how 300 to 400 doctors die by suicide every year.
Yeah.
And so I essentially have 21 reasons why a doctor who has been treated or managed with depression or has suicidal thoughts should come out and share their story. Because
Yes.
in my mind, my opinion, the more it's stigmatized and put under the rug, the cycle never ends.
Yep.
So if someone's able to see someone come out and share their story and share what helped them, it's going to motivate someone else to not feel alone and isolated and go get help themselves. And then therefore we have more workforce in regards to people helping other people. Because literally since the last 10 years, when they've been keeping track of them dying, 300 to 400 per year, when I do the math, it's almost like, how many, 950,000? No. Anyway, you do the math. It's like 300 times 11 is like, what, 3,300
Wow.
doctors? And
Yeah.
say each doctor is taking care of 300 people, 300 times 3,300. That's like 1,000,000 people who lost their doctors in that period of time. But honestly, I believe because a fourth of Americans are depressed, that means a fourth or even more doctors are depressed. The people who have survived it need to come up out of the woodworks and help somebody. It's real. I think that destigmatization needs to just stop. You know what I'm saying? We need to get rid of our ego and our pride. We need to realize that we are humans. I think people will be less sued for malpractice because then patients will have compassion, understand what we're dealing with. I think a lot of exposure will be made in terms of how demeaning and cruel and dehumanizing the whole medical education and training system is.
Yes.
You know what I'm saying? I'm sorry, I didn't mean to go off, but
No,
yeah,
I love this is the passion I was looking for because that's
you
how I feel about
I'm
it
gonna tell
too.
you my hashtag. I haven't revealed it yet, but it's a hashtag that I want at least by September 17th, I want to have at least 150 doctors, which would be equivalent to one medical school class, have their stories. They can even block themselves out and do the little like their voice is distorted if they really don't want to show themselves or face, but I need them to tell what the profession is, when were they depressed or suicidal, and what they did to help them out. Because that will
Mm.
definitely help someone else.
Thank you so much for that. Yeah, I need to connect you with my friend Dr. Sheila. She's the one that helped me actually write my book because she is very passionate about finding other things basically to do career-wise outside of medicine
Mm,
for
mm,
doctors who have struggled with burnout because
mhm,
of how high the burnout rates are. And she's
mhm,
got kind of a similar story of kind
mhm.
of struggling through medicine. So I definitely
Yeah,
have to connect you.
yeah. And let me tell you something real quick. I'm in this book, Black Girls, that basically it gives stories of Black female doctors, also dentists and podiatrists and psychologists in this book. And it's very inspiring because I was the author in this book. There's about 60 of us doctors in here. And the way it was the way they present us to put the questions like, what made you want to be a doctor? You know, why did you choose your specialty? What are you most proud of? What are some obstacles that you overcame? And in this whole book of 60, I'm the only one talking about depression in that situation. That's all cap. No disrespect to the ladies, but if I do the math, it's not mathing, because at least minimum 25% of the ladies in here have experienced depression or suicidal thoughts in this journey. That's no doubt about it. Because it's just, right now, it's like doctors are literally driving 300 miles away to go get care because they don't want to be seen in their town where they work, or paying cash and not using insurance because they don't want that on their record.
Wow.
You know, like and there's a Dr. Pamela Weibel, I don't know if you heard of her, but she does really strong advocacy and supports depressed and suicidal physicians in a private setting, and is always trying to call out what's going on in the system. And right now she has a movement where I believe at the congressional level, they're trying to get it where there's no longer the question on the medical licensing process about if you've had any mental illness or conditions of that nature, to get that question removed off of the application process. That's a petition that's going on for that. I mean, I'm like, because the question is, have you ever been, you know, in a situation where you were asked your medical, that situation in regards to your mental health, and they said violated, whatever. I can say, yes, I was asked that and I answered it. So I'm not really the one to be like, oh my gosh, I'm violated by that. You know what I mean? Because for me to do what I'm doing and not to be cocky or arrogant at all, but when people teach you how to treat them, which means if this system, the way it is allowing us to be intimidated by, you know, their questioning, or they're making you feel bad because you get help, and we just stay under, like, all hunched down, and we're not united regarding it, it's going to continue on.
Mm-hmm.
You know,
Yes,
nothing changes, nothing
absolutely.
changes.
It's important. I think the changes absolutely need to be made. And I'm also concerned about the physical health, concerns that can come along with the mental health levels of stress that people are experiencing. So
Yes,
there's just so
yes,
much, so
yes. And people
much.
are self-medicating. They're either drinking too much alcohol, or, you know, using drugs that are accessible to them at their work. Or I've read stories, people are even having affairs to numb the whole situation out, messing up their marriages, you know, just to not be treated in the public setting because of the stigma associated with it.
Wow, that's intense.
I know we went off.
It's such good information.
You struck a nerve though when you add the depression or the stress or whatnot even in the postdoctoral setting. And I can imagine it's real. Just because I'm a physician, I'm not going to say that there's not that same level of pressure and stress in in a non-physician space. I mean, I can only imagine it's still competitive, and everyone's trying to improve themselves, and there's a lot of pressure, I can imagine, in other spaces as well.
That level of education in general, there needs to be a lot of changes made, right? In order for us to continue to have these professionals that we very much need, something needs to change. And what the last question I had, so as a physician, if someone comes in and is struggling with ADHD, at what point do you kind of wonder or question if it could be a physical health condition causing the symptoms? And what would you usually kind of look for or test for in terms of physical health conditions?
Yes. So if someone comes to me and they are suspicious of ADHD, I'm definitely, because I know what they might be going through. I definitely make it important or a priority for myself to not only evaluate for any medical causes, let's say hypothyroidism. If they have diabetes, it can make you confused or, not be able to concentrate and all over the place. If you're disoriented in regards to your sugar control, I make sure they don't have any vitamin D deficiencies. I make sure their liver, your kidneys are good. I screen them for depression and bipolar disorder, because on more than one occasion, I've actually identified someone who believed they had ADHD. They did have it, but they also have bipolar disorder, which means that the treatment plan for them is different, meaning you cannot give stimulants to someone with bipolar disorder if they have ADHD, if the bipolar disorder is not managed, because you will actually incite mania in that individual by giving them a stimulant if their mood is not stabilized. So I basically ensure that that's what we're dealing with. And you can have both, But if you have both, like I said, the bipolar needs to be managed. But like I said, I make sure they're not anemic. They don't have any, thyroid challenges, and I also assess what their self-care habits are. If they're drinking water, be exercising, keeping themselves nutritionally supported correctly. If they're getting sleep, and make sure or see if those are there or not, and then have them answer the adult self-rating scale and see where they are. And oftentimes when I give the screening assessments, I don't keep the name of the test on there. You know what I mean? Just because I'd rather prefer them not to feel like biased or, jump to that conclusion just based on what they see the title is, and just answer the questions objectively in order to get an accurate determination of what's going on.
Thank you so much. That was a bunch of really, really good information that will help from people who want to go to medical school to people who just in general need work accommodations and people who want to get diagnosed. You're just a wealth of information. So I really appreciate having you.
Two things to recognize and know is that someone's ignorance of their diagnosis does not negate or lived experience of it. Okay? Just because someone has no clue what ADHD is and never heard of it, or doesn't know what it is, it does not mean he's not living it every day and struggling with it every day. Okay, so realize that. Secondly, I want you to know that you can have both struggles and success. Just because you have a challenge does not mean you can't be successful.
I love that. Those are two really, really important points. Thank you so much. Thank you for tuning in to the ADHD Coach podcast. For more information, you can visit my website, gloriajoysherrod.com. There you'll find information about coaching packages, purchasing my book, Adulting with ADHD, and viewing my documentary, also Adulting with ADHD. And of course, don't forget to subscribe.